The mechanism of injury for a sprain is typically a sudden loading or torsional movement. There can be direct or indirect trauma that forces spinal segments beyond their normal range of motion. It can also be attributed to compressive loading forces, usually in conjunction with sudden extension with rotation. The lumbar spine depends heavily on surrounding musculature to increase its stability during mechanical loading. So when you have a sudden loading when the muscles are unprepared, it places increased demands on the ligaments and capsular structures. Signs and symptoms will be pain, swelling, muscle spasm, and decreased range of motion. You may also see lateral shift of the spinal column toward the spasm if severe. A weak core is not going to be very helpful, especially during the compressive loading forces. So those people who have compressive loading forces on a daily basis need to really work on their core. A muscle strain is usually diagnosed after the exclusion of all other possible problems. The mechanism of injury is similar to sprains, a sudden eccentric loading of an already contracted muscle. Contributing factors include poor posture, muscular imbalance, poor conditioning, weak abdominal muscles, inflexibility of the hamstrings, hip flexors, or back extensors. Signs and symptoms include pain, point tenderness, muscle spasm, possible swelling in and around the involved musculature, and possibly a lateral deviation in the spine.